This is one of the commonest symptoms that women complain of during the perimenopause and menopause. It's usually due to a combination of two key changes. Firstly, declining estrogen levels, which lead to a sensation of dryness and tightness, so women can feel burning and stinging with intercourse, which is obviously very uncomfortable. But equally importantly, there are anatomical changes which can lead to the vagina becoming shorter and narrower, which obviously can cause physical discomfort. The changes are entirely driven by declining estrogen levels and eventually, postmenopausally, almost non-existent estrogen levels. Estrogen is vital for vaginal health. Firstly, it is responsible for production of cervical and vaginal mucus and lubrication, which obviously leads to comfort during intercourse, amongst other factors. But collagen is also dependent on estrogen production, and when the levels decline in the perimenopause and menopause, this leads to a change in the architecture, stretchiness, shape and function in the vagina at very basic levels, and consequently can lead to significant reduction in size and width. Firstly, I think a woman needs to address any issues that relate to her and her health, menopausal or otherwise, and that would include treatment options such as local or systemic HRT, if it's appropriate, really high quality lubricants, oil-based, paraben-free organic lubricants and moisturizers, which can really help considerably. If at that stage there are still issues in the relationship and she feels it's not just an individual thing but it involves her partner, then I think more detailed help, more specialist expertise is required. In my own practice, I work very closely with one or two psychotherapists who are trained in psychosexual medicine, psychosexual counselling, which is a highly specialised area. It's not the same as generic counselling, and so women and their partners who go down this route must make sure that they're seeing a properly qualified individual. I would always encourage my patients to be positive, because there is a lot that can be done to help painful sex throughout the perimenopause and beyond. One of the best ways to treat this is to use hormone replacement, either locally or systemically. Local estrogen is exactly as it describes. It's placed into the vagina and around the vaginal area, and that then delivers estrogen locally without getting into the rest of the body. Whereas systemic HRT or systemic estrogen is generally delivered into the body and then reaches the vagina separately. Both of these can be excellent means of addressing the issue of estrogen deficiency. Yes, women in this group should still seek help. Some women may not wish to have HRT, or they may be advised against using it, but there are plenty of options available. I particularly recommend the use of vaginal moisturizers and lubricants, and there are some excellent products out there which are organic, they're paraben-free, some of them are oil-based, so they're very moisturizing, and I would always recommend that patients choose products from that sort of range, avoiding fragrance, colorants, or any potential irritants. Obviously, oil-based lubricants should not be used with condoms, so if a woman is using that as a barrier method of contraception, she needs to use the water-based version during intercourse, but she can revert to using the oil-based at any other stage.